Well, we welcome you to episode number 1 of What to Expect When You Don't Want to Be Expecting. I am Glenn Clark, and I am joined by someone who I've gotten to know the last couple weeks and who I now understand. I mean, this man has done everything. He is maybe the most accomplished person I've ever met in all of medicine, and he's one of the top 100 people who's ever seen my nether regions. He is Dr. Brad Lerner from Chesapeake Urology, and he is here with us for What to Expect When You Don't Want to Be Expecting. Doc, thank you, first of all, for doing this with me. I really appreciate you doing this. I really appreciate the fact that this is something that a lot of people maybe want to talk about but aren't so comfortable talking about. It's a really personal topic, and I think that you're the exact right person that we need to have here in order to discuss it.
Well, thank you very much for having me, Glenn. I really appreciate it.
So let's go over your credentials very quickly, because it is lengthy. You sent me over your resume, and I said, well, I don't have a year. I can't read a John Feinstein book in this process. But for everybody that doesn't know Dr. Lerner, he's the president and senior physician at Chesapeake Urology Associates, Summit ASC Medical Director, Chesapeake Urology Associates, Chief of the Division of Urology at Union Memorial Hospital, the urological consultant for the Baltimore Ravens, and, as if that wasn't enough, also surveyor of the Accreditation Association for Ambulatory Health Care, Medicare, and Solo Privilege. I don't even know what that means. I have no idea what that even means. I just know it's very impressive.
Well, thank you very much. Thank you.
Doc, I guess quickly, before we get into what we're going to be talking about, which is vasectomies, why was this the career path for you?
Great question. I was always interested in trying to help people and just sort of fell into sort of the medical field when I was in college at College Park. I ended up doing an elective course. I was at PG General Hospital and really got interested in it. And then when I went to medical school, I just had a really positive experience in urology. I didn't even know what urology was.
Sure.
When I got to medical school, and had this incredibly positive experience, had some great mentors. And
I would say most men in their 20s don't know what urology is, right? Still to this day, probably don't really know what urology is.
Correct. In general terms, it's like a male gynecologist, basically.
Sure, right, correct. And until you've had a need necessarily to have one, or somebody close to you that's had a need to have one, you probably don't really understand that at all, right? You're probably saying, I've gotten a physical done. It's not like I feel like I'm healthy. Until you got to this point in your life, you probably don't really have any clue what the term urology is.
Correct.
So here we are now, and I'm learning what the term urology is. So the background for this is I am 36. My wife and I have 2 kids. And we had a conversation after the second one where I said, I'd known all along, 2 and I'm good. I'm done. I don't need any more. And she was, for a moment, she was a little hesitant about that. I don't know, maybe. And then after the second one, she came back to me and she said, no, I'm done. I'm done. We're done. I don't want to do this anymore. I said, great. I'll go tomorrow. I am in favor of saying we're done. She said, well, let me think it through a little bit longer just to make sure. And so now our younger son is about to turn 3. And 3 years later, nothing has changed. She is still very much on board that we are done. And I said, wonderful. So I have reached that moment for me, and I have decided it's time for me to get a vasectomy. But I realized when I came to meet with you, I didn't know nearly as much about vasectomies as I thought I did. And it turns out I'm not alone, because I ran this by some of our listeners. And again, everybody's familiar with the term vasectomy. Obviously, if you've had one done, you might know a little bit more, but a lot of people certainly have heard the term snip, but don't really know what it is. So let's start with the dumb guy question of the day, Doc. What actually is a vasectomy?
So, great question. So, a vasectomy involves removing a small portion of a tube called the vas deferens, which is about 1 foot long. It connects the testicle to actually the base of the penis and the prostate, where it delivers the sperm. Which is about 10 to 15% of the semen or the ejaculate. So you're actually just interrupting the flow of the sperm, so the sperm no longer will be in the semen, and therefore eventually you'll no longer be able to get your female partner pregnant.
Okay, so let's take a step back.
Okay.
I will continue after I have this procedure done. I will continue to produce semen. correct?
Correct.
I just won't be able to transmit that semen, I guess is the way to say it.
Well, what I would say is, so the semen actually is composed of 3 components.
Okay.
There's fluid from what's called the prostate gland, there's fluid from what's called the seminal vesicles, and then there's the sperm fluid. So after a vasectomy, you'll no longer have the sperm fluid contributing to the semen. So you still will have semen, you still will have an ejaculation. Nobody's going to know the difference because, again, it's about a 10 to 15% decrease in the volume, so no one would know the difference in color, consistency, or volume of the fluid.
This is the stuff that you got taught in 6th grade sex ed, but you were too embarrassed to be paying attention, so you don't remember it fully exactly what it is. But I get what you're saying, which is that, like, and we'll get to this a little bit later on in one of our future episodes, is what things are going to be like afterwards. But essentially, you're preventing any of that sperm from being able to get through.
Correct. You're basically blocking the flow of sperm through the tube. It'd be like you have a hose attached to a faucet, and all of a sudden somebody puts their foot down or cuts a piece of that hose out. The water no longer flows through there. But the important thing is you're not sterile, or you still have the ability to get a woman pregnant immediately after a vasectomy.
Let's talk more about that in a minute.
Okay.
I did not know that. Okay. I learned something recently. We'll talk more about that in a second.
Okay.
As far as medical procedure is concerned, this is a surgery.
Correct. It's considered a minor surgical procedure.
Okay. Do you go under? Do you like what is it? What is an actual, like, I'm reporting today for my vasectomy. Do I need to have somebody drive me and pick me up? What actually am I doing? Because when you hear the word surgery, obviously people start thinking, well, this is something significant.
Right. Great question. So I would say probably 98 to 99% are done under what's called local anesthesia, which is similar to going to the dentist. Getting your tooth numbed up obviously is a different part of your body. So
significantly different.
Yes. So we basically use a small needle with a mixture of a quick-acting, long-acting numbing medication to numb up the area in the scrotum and the vas deferens area. And it usually involves a little tiny opening in the scrotum where you're able to actually bring the tubes outside from inside the scrotum, remove a segment, you seal the ends, drop the ends back in, and it typically takes about 15 to 20 minutes to do under local anesthesia.
Okay.
There are some men that have a lot of anxiety about it and then typically will undergo what's called sedation, which is what people typically undergo when they have a colonoscopy done, where they make you sleepy, but not to the point where you need to have a breathing tube or have your breathing supported. But
anxiety would be the reason why somebody... that was one of the things that I heard from a listener is it turns out my insurance company offered that when I got my vasectomy done, I could go under. If you're someone who deals with anxiety, that would be something that you might consider?
Yeah, I would say the 2 reasons for putting someone under anesthesia, like IV sedation or general anesthesia, would be either they're really anxious about it, or sometimes because of their anatomy that, there's some men that have this really high, tight scrotum, or maybe they had some prior injury or surgery in the scrotum, which caused some scar tissue, which would make it more challenging to do with them awake. So we then recommend that they undergo sedation or get sleepy.
But you said this is not like typically 98 to 99% was the number that you used. So people that just local anesthetic, you're fine. Not going to be a problem for you whatsoever when you go through this.
Correct.
All right. That's good to know. The other one I got was I was told a horror story. And I'm sure this is one of the things that people think about when they try to decide if they're going to have a vasectomy. I was told a horror story by a listener who said, and I'm sure this was not from Dr. Brad Lerner at Chesapeake Urology, which was their first mistake. But I was told that when they had their procedure done, they didn't get enough Novocaine, if you will, and that that first feeling was really, really painful. Have you ever had an experience like that in all of your years? When somebody gets nervous about this or apprehensive about something like that, is that something that I should be nervous about?
I would say that you shouldn't be nervous about it, because obviously when we give you the numbing medicine, the local anesthesia, we're trying to completely numb the area up. Occasionally there's a small part that maybe doesn't get numbed up initially, but as we're starting to do the procedure, if a patient says, "Hey, I'm feeling that or this hurts," then we just give you some additional numbing medication, and that should take care of it.
All right, but this isn't going to be like a murder scene or anything along those
No,
lines.
no, we're not going to
afterwards.
continue to do the procedure
If
where
you're-
somebody's kind of thrashing around the bed or
Screaming bloody
or
murder.
trying to jump off the bed, right, or yelling or screaming. No, that's
All
not
right.
going to happen.
To make an appointment with Dr. Lerner or any of the specialists at Chesapeake Urology, call 410-896-1616 or go to ChesapeakeUrology.com. Chesapeake Urology is a leader in vasectomy surgery. This is What to Expect When You Don't Want to Be Expecting. Glenn Clark alongside Dr. Brad Lerner from Chesapeake Urology. So, Dr. Lerner, we talked about what a vasectomy is. Let's get in more now to who a vasectomy is for. Let's talk a little more psychologically, right? Like this is maybe gets a little, and you and I had these conversations when I came in to see you, and I'm going to present the conversation this way. I mentioned to somebody that I was looking into getting a vasectomy maybe a month or so ago, and they looked up at me and they said, "You're 36. You're way too young." And I couldn't really understand why they would say something like that. So can we talk a little bit about, the conversations that you have when people come to chat with you and trying to figure out who is a vasectomy for?
Great question. So a vasectomy is for any man that no longer wishes to have children. And typically it's men who are married or men who are involved in relationships that have had children in the past. There are some patients that I see that are single, or they may be in a relationship, but they've made a decision they do not want to have children through intercourse. Maybe they're consider adoption
Sure.
or something like that in the future. But it's basically for any man that has come to the decision that he does not want to have children in the future.
All right. So is there any reason, again, we'll get the medical, and is there any reason that somebody would present to you where you might say, "I'm not sure if a vasectomy is for you"?
Yeah, I would say that in speaking to the patient beforehand, because I do a consultation before the procedure because I want to make sure that it's right for that individual.
Right.
If I get a sense that they're not absolutely sure, or their wife or their partner is not absolutely sure, certainly we'll counsel them that, listen, this is a permanent form of sterilization, but is this something you really want to do now, or do you want to wait and reconsider that in the future? Certainly when I see men that have never had children before, I counsel them strongly about that. But again, if they're a competent adult and
Right, you're not going to say, "I'm going to make the decision for you."
Right, I'm not going to make the decision
Right.
for them, but my job is to provide them with as much information as I can so they can make an informed decision that they feel is best for themselves and their circumstances.
I guess I should follow that up with, because we were talking about is there a medical reason why maybe a vasectomy might not be for someone? Is there anything that, when you go over my chart and I had to fill out all that information for you and tell you about all the different things, is there anything that you would say maybe vasectomy might not be for you for medical reasons?
No, I'm really not aware of any specific medical reason why someone shouldn't get a vasectomy. In the past, there had been studies and sort of ties into different issues in the body, whether it's cancer, heart disease, arthritis, things like that. But, nothing was ever borne out. And so, the official stance from, our governing body, which is American Urologic Association, is there's no known association of vasectomy with any other disease process in the body.
Okay, all right. So there's no reason why anybody shouldn't be able to go through this type of procedure.
Correct.
And then the one that I feel like I got most commonly, and it's something that it's funny, I never even thought about, right? Like I just said, "Hey, I'll do it," right? But my wife, there's options for why maybe we could have gone the other way. Why would a man choose to get a vasectomy instead of perhaps his partner choosing to, and I don't even, I think the term is tubes tied, getting her tubes tied once you decide we're done, we don't want to have any more kids, or we don't want to have kids at all?
Yeah, no, great question. And so it's called a tubal ligation.
Okay.
And it's similar to what you do in the man. So there's
I totally knew that, by the way. Obviously, I knew it was a tubal ligation, right?
Sure. So there's fallopian tubes which connect the ovaries to the uterus. The vas deferens connects the testicle to the prostate at the base of the penis. And they're both very good procedures, have a very high chance of a successful outcome. The difference is it's more invasive in the female because they have to go into the abdominal cavity, and they typically have to undergo general anesthesia, so they have to get a higher level of anesthesia.
Okay.
So again, I think for a man, he can get it done under local anesthesia with less risk. The woman, general anesthesia, likely slightly higher risk. And I also think, what I'm seeing a lot of is couples are waiting till they're older to have children, and a lot of the wives are saying, "All right, it's your turn.
Sure,
you need to step up and get the vasectomy."
And we're going to get to reversal later on in a future episode, but is there, just specifically making this comparison, I think over the years I had heard it's more difficult or impossible to reverse and I've already forgotten the term already that I swore to you that I knew, but the deuteronomy?
Tubal ligation.
Tubal ligation. I was right there at the tip of my tongue. That it's more difficult to reverse a tubal ligation than it would be to potentially reverse a vasectomy, which again we'll get to in a later episode.
I mean, they both can be reversed.
Okay.
They both can be reversed with a high degree of success, but again, it's much more involved because it would be intra-abdominal general anesthesia. And there are other things, which we can talk about later as far as options for having children in the future after getting a vasectomy or tubal ligation.
All right, we will get to that as we're going to continue along. This is what to expect when you don't want to be expecting. I'm Glenn Clark, and I don't want to be expecting anymore. He's Dr. Brad Lerner from Chesapeake Urology. And again, to make your appointment with Dr. Lerner or any of the specialists at Chesapeake Urology, call 410-896-1616 or go to ChesapeakeUrology.com. Chesapeake Urology is a leader in vasectomy surgery.